Let's update you on the country's battle with COVID-19 now. The variants first found in the UK and India have now been detected in South Africa. At least 4 people have tested positive for the variant that's said to be part of the devastating coronavirus surge in India. 11 people, meanwhile, have tested positive for the one identified in the UK, with the Health Ministry saying on Saturday that community spread is now already suspected where that variant is concerned. Dr. Kanyim Somi is head of virology at the University of KwaZulu-Natal and joins us from Durban tonight to talk more about this. Doctor, good evening. Grateful for your time. So how worried should we be? I know the Health Ministry is saying do not panic, but is there real cause for alarm?
Good evening, Tamegile, and good evening to the eNCA viewers. There is a reason to be vigilant, but not to panic, and no reason for alarm based on the new variants that have been detected in South Africa.
And B16172, that's one of the multiple variants currently driving the coronavirus crisis in India. No indication yet, no evidence yet that it's more deadly, but they do believe, the scientists abroad, that it is more transmissible. Do you expect it to then become the dominant variant in South Africa?
If there is sufficient community transmission or from the importation, it may happen. But what we currently have in South Africa is that the variant initially detected in South Africa is the one that is predominant, exceeding 95% of the viruses that are circulating in South Africa. So if it does replace the currently circulating variant, it will be a matter of time. It would not be just an immediate a swap of viruses, for lack of a better word.
And I suppose the hopeful news that we can take from this is that at this stage, again, there's no evidence that these two variants weaken the efficacy of vaccines or that they cause more severe illness.
That is what is comforting. The evidence that is coming through is that vaccines are still showing efficacy against the variants that are being detected all over the world. And also it's important to mention that it's not just detected in India. This particular variant is also detected in over 30 countries all over the world, including India. And so it is also reassuring. There's evidence that's come from Qatar recently and many other parts of the world showing that there is not a vaccine escape from these variants. And also we have conclusive evidence that the vaccines are able to prevent a severe infection and mortality, which is very crucial.
And a lot of South Africans yesterday, in reacting to the news, were saying this is what they were afraid of when there were calls made for the South African government, for example, to ban travel to and from India. Would a decision to impose travel restrictions from India and any other countries where we're seeing variants that are perhaps not existent in South Africa, would that be effective at this stage in the game?
I highly doubt that, considering also how widespread these variants are all over the world. I think the one that has been found in South Africa, which was initially detected in the UK, is now detected in over 100 countries. And the one that was detected in India is circulating in over 30 countries. So deciding to ban countries from interacting with South Africa may be a bit impractical at this point. And also bearing in mind that the main measures of preventing infection remain unchanged, irrespective of what type of variant we're dealing with. We still have to wear masks, physically distance, and also sanitize. And as soon as vaccines are available, then add that to our armament of prevention. So our prevention strategies remain the same. What perhaps South Africa will need to strengthen is a screening and testing at ports of entry to ensure that we do not get an overwhelming importation of new variants into South Africa. So if that is strengthened, then we should not be worried.
Pardon me, Doctor. This confirmation that we've got these two new variants circulating among us, with the news that the likes of Gauteng, the Free State, KZN and the like are now heading into their third wave of the pandemic. Is it time to consider a stricter lockdown?
I think our Ministerial Advisory Committee will definitely weigh all the evidence that's currently available. I'm sure they do have thresholds that they use for making a decision on whether to change alert levels, which I'm not currently privy to, but I do believe that all considerations will be taken into account when that decision is made. And if it is an appropriate measure to be taken, I'm sure it will be warranted and it will be taken, Julie.
Dr. Khanyi Msomi, UKZN's Head of Virology. Good to speak to you tonight, ma'am. Thank you.